So my next question is fit for Senator Pan. Senator Pan, as a policymaker well-versed in the LTSS crisis, what are your thoughts on the stakeholder committee recommendations for a new social insurance program in California? Where would you say that the legislature is on this issue right now?
First of all, thank you so very much for having me on this panel. And I have to begin by recognizing the leadership of Senate Pro Tem Toni Atkins, who gave the initial remarks when she became Pro Tem and met with each of us senators about our different leadership roles. She pointed out that the leadership on aging was one of her top priorities. I was very proud to be able to work with her on that and to make that same commitment, as well as her chair of both Health and the Budget Subcommittee on Health and Human Services. As we are looking at the Master Plan on Aging, this is an issue that has already come up before me as the Budget Subcommittee chair, even before Governor Newsom came into office. So when I first became Budget Subcommittee chair and I was looking at how we were spending our Health and Human Services dollars, I recognized that we were underinvesting in aging. And in fact, I actually even posed the question during a hearing to the Department of Aging and Department of Finance as well, are we planning for our future, looking at our demographics? And I actually got the answer, well, no, we're taking it year by year. And I said, well, that's pretty scary, because I don't think this is a year by year thing. We know that our population's aging. There are more demands. We have people with disabilities, and we need to be sure we're planning for that future. And in fact, I held a hearing specifically on this issue. And out of that hearing came out the fact that if we just maintain benefits at the same level they are now, so we're not talking about increasing benefits, just keeping benefits the same they are now, based on demographic changes, we would need to commit to increasing the funding we're giving to aging and disabilities by an increase of 5% per year, which is larger than the growth of our GDP in the state, or of course the country as well. So that pointed out that, okay, well, we definitely need to figure out a better plan. And I was very proud to work with the coalition on a bill I had, SB 512, that actually called on an actuarial analysis to look at creating a social insurance program. Very proud that we moved that bill forward, and then the governor announced that he was going to do a master plan of aging, and so this bill sort of got folded into that. And so I'm very excited to see that we have a report coming out. Now, I do want to thank Dr. Torres-Gil for the fact that he's pointing out that it's not just about the money, it's about the buy-in, right? So when we talk about the legislature and where are people on, it's really about building that political will. And I think it's very important to figure out how we frame this particular issue, right? So as I will point out, when I'm in my budget subcommittee, I ask people, well, oftentimes when you have a new program, finance will come and say, it's going to cost X amount of dollars. The question we don't ask is, well, if we don't do that program, how much will it cost us? That's the real alternative. The alternative is not, oh, do we want to have a new program or not? The issue is that what's the issue that this program is solving? And if we don't have that program, how much are we paying for it as well? So that's the real net cost to think about. And so when it comes to LTSS and what we're talking about here, which is a social insurance program, and I want to point out, we're talking social insurance. We're not talking about a welfare program, which has its place. We're not talking about means testing. This is about social insurance program, recognizing that all of us and our families are going to have to confront this issue at some point in time, right? And so we need to go and talk to the public, and that of course also influences other legislators as well, is that we're not just here saying, well, we need to raise a tax to create a new program. We also have to turn and say, look, if we don't do this, what is going on? What do we have to pay for? So this is really about, it is about dignity, it is about services, and but it's also about actually our financial future as a state, and what makes sense in the way we redirect our resources and our dollars. And I think that's a very important part of the conversation that we need to frame. And so I know that probably have more, I could take much more time talking about that, but I'll end it here and look forward to the questions about this, how we frame this issue in a way that people understand that, look, this is a better choice. Okay, it's not just about, well, you're paying more taxes. This is actually a better choice for the tax dollars you may already be paying as well. And so I think that's part of the conversation. Thank you.
Thank you so much, Senator Pan, for those important words.